Hi there, everybody. Welcome to series 5. Oh my God, how have we done 4 already? And number 5 is here. Series 5, episode 1 of Probably Nothing. I am Karen. My name is Karen Hobbs, but I'm a nice Karen. I promise you will find that out as we go through series 5 together. And I work for the Eve Appeal, the UK's gynae cancer research charity, and I run the Ask Eve information service, which is a free, confidential, nurse-led service. I work with the amazing nurse Tracy, who you may have seen in previous episodes. And yes, we run a free service where people can call or email any type of gynae cancer query. We started Probably Nothing over a year ago now because, and also if someone's watching this that's watched previous episodes and thinks, oh God, here she goes again with the same intro, I am very sorry. You'll just have to deal with it and support a gynae cancer charity. And if anyone's listening for the first time, then this is all brand new information to you. So I'm very glad. Yes, we started Probably Nothing over a year ago because we were getting lots of questions, especially since the start of COVID in March 2020. We're getting lots of questions from people saying, sorry to bother you, I'm a bit worried about X issue. It's probably nothing but, and then they'd go on to talk about their gynae cancer concern. And the kind of good thing, I suppose, is that most of the time when it comes to potential gynae cancer concerns, the Probably Nothing is nothing. It's not cancer, it's something less serious. But for 58 people every day, it is something. 58 people are diagnosed with a gynae cancer every day, and we wanted to create Probably Nothing, which, as I've said 3 times now, is on series 5, to show each week kind of some information about a different topic where I talk to an expert or an advocate or a different charity, a sister charity, talk about a different gynae topic and hopefully put across information in an easy to understand, accessible way, and also people can just ask questions. We will answer your questions during the session, and hopefully kind of put some sort of common myths and common myths to rest and to answer some common questions. My phone, I realise I'm in a tiny little window on your screens. My laptop is playing up. It's not the best laptop in the world, so now I've got you in a little ring light stand on my phone, but because it's a cheap ring light stand, I can't turn it to the side. So you're portrait for me, I'm portrait for you. You'll have to deal with it. I'm very, very sorry. So, long intro over. My intros get longer and longer, and Ben from Disruptive, who are the amazing company that do the live streaming for us for free, they're wonderful and gorgeous. Please shout out to them and follow them. He was already teasing me backstage in the backstage area about how long the intros are, and I'm just proving him right by going on and on and on. Right, on with the show. Okay, so this first episode, so episode 1 of series 5, is going to be about vulval cancer, the symptoms, and what to do, what to expect if you are indeed on a vulval cancer pathway or think you might have potential symptoms for vulval cancer. We've got some common questions to answer. And vulval cancer, so there are 5 gynae cancers, if people are tuning in and don't know that, in order of prevalence, so how common they are in the UK. We've got womb, ovarian, cervical, vulval, and vaginal. So this episode is about vulval cancer. And I would love to introduce you to my guest, who is Clare Baumhauer. And I had to, hello, Clare.
Hello.
Hello. I was just saying to Clare backstage that I wanted to get her name right. So me and my housemate Michael were listening on those weird pronunciation websites. I typed in her name and I was going, Baumhauer, Clare Baumhauer. Clare is a woman of, I would say, you've got 2 big strings to your bow. Clare, oh, is that a cat?
Yes, that's Sooty. Come to join us.
Oh, hello, Sooty. See, I knew I asked Clare on here for a reason, because anyone else will know that my cat Arthur has made the odd appearance in episodes of Probably Nothing. So I knew there was a secret extra reason, Clare. Clare is my favourite sort of person to talk to because I love all the doctors we talk to, but Clare is first of all a patient advocate. We will talk about her personal vulval cancer experience in a bit, but also at the same time as of having gone through what we're going to be talking about, also in her spare time runs 2 support groups for vulval cancer UK awareness and lichen sclerosus UK awareness. We'll talk about what lichen sclerosus is in a little bit. So Claire, I've spoken for long enough. Can you just say hello, Claire, and just tell us a little bit about the why you're here to talk to me, and then we'll get into your experience a little bit later.
Well, firstly, I was diagnosed at the age of 43 with stage 3 vulvar cancer and also lichen sclerosus, both conditions I'd never heard of, and anybody that I'd spoke to hadn't heard of it either. So through that, I started to look around for other awareness and couldn't really see a great deal. So that sort of spurred me on really to start my own support group and also to start raising awareness, mainly online.
And so is it kind of fair to say that, because not to bring it back to me, but I didn't know anything about cervical cancer before I was diagnosed with it. Did you, before you obviously got, a horrible diagnosis at a young age, did you know much about vulval cancer kind of awareness or symptoms or anything like that?
No, I hadn't heard of it. I didn't even know the vulva until I was diagnosed with it. Like others, I called it vagina or down there. So no, it was a shock to get told that one, you got cancer, and one, you had one that you never heard of, and the third shock was in a place I never even dreamed of thinking you could get cancer.
So that has been so much to take in. You're thinking, I've never even heard of this disease. I didn't even know I had the area that the disease is in. That's a lot, isn't it? It's so different, isn't it, when it comes to gynae stuff compared to things like, we're taught, I don't know about you, but I was taught, from a young age, and very kind of open chats with my mum. I knew, because I had boobs, I had to check my boobs. You just get taught that sort of thing, don't you? But I didn't know anything about checking vulva, checking vagina at all.
No, I hadn't. It is something that, even though I'd had symptoms of lichen sclerosus, which we'll talk about in a minute, for many years, I still never really looked. And so I wasn't really aware of what it should look like, what it did look like before. So that is something which I definitely advocate for, that we should look, and often, because, we don't know what is our normal and what we should look for. So that is something as well which I thought that we're not told, even when we visit doctors or even when we have children. It's just something that we're not told to do, and that is something that's really important, which I found out the hard way.
Of course. And so Claire was saying just a second ago about how she didn't even know she had a vulva before she was diagnosed with vulval cancer and called it a vagina. That is so common. I definitely called my vulva vagina before I kind of entered the gynae world, the gynae cancer world. At Eve, we've done, if people are watching and kind of follow us on social media, we've done lots of different surveys and things, and people calling the vulva the vagina is a very kind of common thing for people to do, because we're not properly taught body parts, anatomical terms, and I will use this as a little platform, because whenever I get an opportunity, I say I don't know why I'm not a millionaire for coming up with this, but the way to remember it is vagina is on the inside because it's got the word in it, vagina. Vagina is inside. If I took my knickers off now, which I'm not going to do because it's not that sort of show, it's not dark enough outside yet, you would be able to see my vulva. So Claire, correct me if I'm wrong, but vulva is everything from the mons pubis, which is basically where your pubic hair is, that mound, all the way around. So you've got the labia, the clitoris, everything up to the anus. So it's the whole external genitalia, isn't it?
Correct, yeah. And everything you can see outside. If anyone says that you can look at your vagina, you can't. Only somebody, a doctor with the right equipment, can do that. So you can't see it. Only the vulva you can see.
That is perfect. You can't look at your own vagina. I love that. That's a great way to remember. So let's talk about the signs and symptoms of vulval cancer. So obviously, if somebody knows signs and symptoms for something, they can hopefully, if they're able to, get to their doctor and get diagnosed more early. And that's what we're all about at the Eve Appeal, is early diagnosis, risk prediction, prevention, etc. Can you talk us through the symptoms? So if someone's got a mirror, they're looking at their vulva, what would be cause for concern? What are the symptoms?
Well, the symptoms are different for everybody, and you haven't got to have all the symptoms. But you can have itching, you can have red, dark patches, raised white patches even. You can have pain when you go to the toilet, stinging, burning pain. You can also have a lump or an open sore ulcer, which is the most common types of symptom of cancer, which would be a lump or an ulcer. Mine was an ulcer. Also pain of intercourse. Sometimes you can have blood in your discharge. Again, that's not one of the common symptoms, but it is still one. So there are quite a lot of symptoms, but just some people assume you might have all of them, which you don't. You can only have a couple of those. Mine was just literally, I had the lichen sclerosus symptoms, but my cancer was an actual open sore.
So that's so interesting. So the symptoms you listed, so someone could have a lump and none of the other symptoms. So they could have a lump, say on a labia, lip, like, so if we're going like that, like, so say a lump here, if we're imagining that's the labia, and no kind of flaky or white patches, no pain during sex, just a lump, and that could still be a sign on its own.
Yeah. There's several types of vulvar cancer. So some are caused by different things. For example, mine was lichen sclerosus, or it could be lichen planus. You've got precancerous condition as well, VIN. You could just have melanoma, skin cancer, and there are 3 other rare ones. I won't even attempt to pronounce those because they're quite hard. They're normally just lumps. So yeah, so it's quite difficult. I understand why sometimes you can get misdiagnosed, because there are a lot of vulvar conditions and they've nearly all got the same sort of symptoms, including thrush, which is one of the main symptoms, which is often misdiagnosed, especially for lichen sclerosus, sometimes even for cancer as well, because again, burning, itching, soreness, they're all similar symptoms, so it's quite difficult. Make sure, like you say, if it's not something you've always had, then see a doctor.
So yeah, so it's kind of what you're saying is, if something changes, like, that's when, because everybody's genitals, nobody in the world has a matching vulva. That doesn't exist. So it's no good looking at a vulva on the internet, or lots of people get their now kind of body information. Younger people, I think, especially when they're watching porn, sometimes it might be the first time they've seen someone else's vulva other than their own. But it's about knowing what's normal for you, like you were saying earlier, and spotting when something changes. You spoke, Claire, about your diagnosis and lichen sclerosus, and we mentioned about the group that you run at the beginning. I can imagine that somebody might be watching this and thinking, what on earth is that word, or those 2 words that they keep saying? I barely heard of a vulva before starting with the Eve Appeal, let alone conditions potentially associated with these cancers. So can you just tell us about lichen sclerosus and then about lichen planus, please?
They're both skin conditions. They're chronic inflammatory conditions. Both can be anywhere on the body, but it is more common to be in the vulvar area. It can also be any age, as young as 2 has been diagnosed. It is quite common in the over 50s, and that's why I think where doctors quite often misdiagnose younger women, because they think they're not over 50, it can't be that, but it can be. And there are more and more getting diagnosed now in their 20s and 30s and 40s. It can also be men can get it as well. And theirs can also, if it's untreated, the same as less in women, can also turn to penile cancer, where you can have vulvar cancer and they can have penile cancer. So they're both, conditions which need to be checked and monitored for that reason alone. Lichen planus also the same. The conditions for lichen planus is slightly different. It's more redder, and it's also inside. So it is inside, which is it can be in the mouth or it can be in the vagina area. Again, you can have both conditions together. There's a few in our group that have both LS and LP. Again, they both have similar symptoms, but more so lichen planus is inside the vagina, whereas lichen planus is only ever outside the vulvar area. The symptoms there is quite a lot of symptoms for LS, again, similar to other conditions, but the most common one is itching, but again, you don't have to have itching. There are many that don't. You get no symptoms at all, not even known. It's picked up by a specialist that sees it during another exam they're doing. The other common symptoms are white silvery patches, raised, Your skin looks thin, although it's not. It's actually thickened skin, but it can look thin, almost like cigarette paper thin. It can have cracks and tears in it, like almost like paper cuts again. So when you go to the toilet, it burns. If you've got any friction or you scratch during the night, you can get blood blisters, bruising to the skin. You can also lose a lot of your architecture, which is again, I think, why more probably diagnosed in their 50s, because by that time you might have lost your clitoris, because that can get buried under the scar tissue. You can lose your labia as well. It can shrink, sticks together, all the scar tissue. So it can look quite different. That's why it's so important to check what it's like when you're younger, so that you notice when you do have symptoms later on in life, you can tell then, oh, it does look different, it's shrunk or something's changed. So yeah, there are many symptoms to lichen sclerosus which do mimic some other conditions, which is why it's important to get seen, especially by a specialist.
And so you're talking about how it can lead to vulval cancer. Is it likely that someone with lichen sclerosus will end up with vulval cancer, or do loads of people have LS and never get vulval cancer and just have to manage it?
If your vulval cancer is caused by lichen planus or lichen sclerosus, then it is normally those that have had the condition undiagnosed and untreated for many years. Not always, but mostly. In my case, a lot of others, we've had it for years, undiagnosed, not using steroid creams, and then it has turned to cancer. It's normally only around about 5% of those with lichen sclerosus, it does turn into vulvar cancer. So it is quite small when you think how many people probably walking around not even knowing they've got lichen sclerosus, which we think probably thousands are, and they're fine. So it is very small, so not to worry, but just to make sure that you're aware of it, so that you can check any changes and then speak to your doctor.
Of course. And how is LS managed? So if somebody notices some of the vulval changes that you described, goes to the doctor and gets diagnosed with LS, first of all, do they have to see a specialist, or can a GP tell that it's LS, or do they have to refer to a skin specialist? Or
it all depends on the GP. If the GP has got a special interest in vulvar diseases, or sees a lot of patients with it, and they recognise the symptoms and know the treatment, and hopefully go on conferences to get more training, then yes, great. But a lot of GPs don't. In my own case, I was misdiagnosed for 38 years with GPs.
Wow.
And I saw
38 years, Claire.
Yeah, I saw a lot of GPs, and I was told cystitis, thrush. Towards the end, I was told herpes, and it wasn't. It was LS. So you have to, make sure your GP is aware of it and knows the condition well. And if that's fine, then yes, stay with those. Otherwise, you can get referred. Again, GPs aren't sure who to refer to, because it's a gynecological place, but it's a skin condition. So again, that can be either, as long as they specialise in LS, because it is a hard condition to diagnose on site, and even sometimes when doctors aren't sure, they will then send off and you have a biopsy, and sometimes that's false positive, because if it's taken in the wrong place, or you've been using steroid cream for too long, it can alter the result. So that's why you really need to see a specialist, and you need to see them for a while as well. Make sure that you go back. A lot of them will give out steroid cream and then see you in 4 weeks, and then again 3 months, and then 6 months, and then yearly. But obviously, because the NHS, we haven't got enough money, and there's not enough clinics. Quite often you don't get to see them that often, but then you are referred back to your GP. But that's only good if your GP knows what they're looking for. If not, then you just have to advocate for yourself and be, obviously don't be rude, but just be a bit more assertive and say that you need to see a specialist. It's a condition which can turn to cancer, and it needs monitoring. So just make sure that you are seen. The treatment for it is, at the moment, is a high potent steroid, which works in most cases. You'll use it once daily, normally for a month. And if symptoms are getting better and doing okay, you can drop back to every other day for a month, and then again twice a week. But that's only if you're doing well. That's a guide. So if you're not, you can continue daily for 3 months or longer. Again, why you need to see a specialist. And then once you are in remission, flare-free, then you can step down to maintenance dose, which is proven research studies now that it does and can prevent cancer by using the steroid regularly. So I only need a small amount, a pea size. It's safe on the vulvar area. It's different like in eczema. If you have it on the face and other areas of the body, then you've got more chance of skin thinning, to have reactions to it. But when it's just for LS, and in the right places you're putting it in the right amount, then it is safe to use, and it's recommended to use. There's multiple steroids to use. If one's too strong, you can try a potent one or a mild one for maintenance dose. Again, why you need to see a specialist, because they need to check your vulva regularly, see how the steroid's working, see if you're doing it in the right place and the right amount, and then keep you on that plan, and then onto maintenance, and then just go back as and when you have any more problems, and just make sure you're aware of the cancer risk and what to look for. And if your steroid isn't improving after using it daily after 2 weeks, then you need to go back and they need to check. And if there is an area that's not healing, then you need to have a biopsy just to rule out cancer, and then also the pre-cancer.
That is so helpful. Thank you, Claire. I can't get over that you said you were misdiagnosed for 38 years. I think people watching will have gasped like I did when you said that. So you said before how you were kind of misdiagnosed from, even things like herpes, and it just wasn't. It was LS. How did it come about that you kind of eventually got the vulval cancer diagnosis after being passed, it sounds like, for years from pillar to post with no one giving you the answers you needed?
Well, I only really got diagnosed in the end because of the tumour was so obvious. I went back to another GP. At first, she said it was herpes, but saw the shock on my face, I think, and she told me to go to a gum clinic, which I wouldn't have gone to. So if I hadn't gone, I'd be dead now. But because I think she saw the shock on my face, she said to me, actually, it might be something called vulva cancer. And then she said, I'm going to put you on the 2-week urgent referral. And then she looked at me and said, please go to it. If you haven't heard anything in 2 weeks, you come straight back and see me. And then within a couple of weeks, I had 3 biopsies done, and then got the diagnosis both of LS and vulva cancer. But before that, obviously, I'd self-treated myself, which is something else I've learned not to do. All those times I saw GPs, I never had any swabs done either to even say it was definitely thrush. They just handed me the thrush treatment. I bought it myself a few times. I went online, Googled. I got myself Vagisil and all the other creams to use. It would help for a couple of days, but then that was it. Went back to the doctor again. And all the times I looked, I was only ever looked twice as well. I only actually looked at my vulva twice, and all them times. Not even looking. Said straight away it's thrush, gave me the creams. The first time was when I was quite young, and my mum took me, and the doctor said it was cystitis because I was saying it was burning when I was going to the toilet. Obviously, I wasn't giving the correct symptoms because I was too young to know, but he never looked then either, and never really looked until I was much older.
Wow. So what stage were you diagnosed at, Claire?
Well, that was quite complicated. I was originally diagnosed at stage 1B. And I went in for my surgery, but from my scan and my surgery, the tumour grew too quickly and aggressively, so they couldn't get clear margins. So although I had the tumour for at least a year, so not to worry anyone, it can be quite slow growing, but I had this there for about 2 years and the ulcer for about a year before I was diagnosed. But then in that time frame of the scan and my surgery, it just grew too quick. So they couldn't get clear margins, so I had to have radiotherapy after. And then during one of the scans, my oncologist said that you've got one of your lymph nodes swollen. Although they took a biopsy off of one side and it came back clear, the other side I had another swollen one, and he didn't like the look of it. So he said after radiotherapy, if it's still swollen, I want to go in and have a look. So 6 months later, he decided to go in, and he removed 6. 3 came back cancerous, so then it obviously spread to my lymph node, so was upgraded to stage 3. So from then on, I had quite a few complications around a couple of months. I ended up having 4 surgeries because I had infection, got sepsis, I was quite unwell, my drain come out, all complications happened. So then by the time I had my second lot of radiotherapy, which was over 8 weeks because I had to have 33 sessions, all my treatment in the end took 16 months. And again, it's the reason why I do what I do, because I was quite angry really that I had left that long, and by the time I was diagnosed, because it was much later, I've had to have a lot more surgeries. radiotherapy twice. That's obviously at the age of 43. That put me straight into menopause instantly. So all the symptoms you get all at once.
That's such a whole other huge thing to go through, isn't it? On top of everything else, having to deal with that as well.
That with lymphedema as well in my abdomen, pelvis, and left leg, and all the nerve damage and all the other side effects that come with radiotherapy. So that needn't have happened if it had been caught early, stage 1. You know, quite often you'll just have surgery again. That's not no easy feat in the vulva area. But you know, it would have been maybe one surgery and that would have been it. But obviously, I had to go full work because it was caught so late.
Of course. Yeah, I think we're exactly on the same page, aren't we, about how important it is to get diagnosed early. Of course, sometimes for whatever reason, some cancers can't be diagnosed early, but I can absolutely understand why you're doing what you do. And of course you felt angry. You'd had these symptoms for years and then were upgraded from a stage 1 to a stage 3 because of how long things have been left. And it's the only time in your life you don't want an upgrade, isn't it, when it comes to cancer staging? Yeah, on the free, like extra leg room on flights, yes please, but a cancer stage, no thank you. Claire, can you just tell us, we've got a few more minutes, can you just tell us about the 2 groups that you run? Because as I mentioned at the beginning, I run, for people who've just tuned in a bit later, the Ask Eve information service with Tracy, but lots of people, once we've given them kind of information and advice with, go to your doctor, or here are the potential symptoms, or here is potential treatment for vulval cancer. And sometimes I think often we miss out in whatever medical conversation. I think the sort of the mental health side of it is often forgotten. And you know, my surgeon saved my life, but he didn't support me. He just, you know, got rid of my cervix, great, but what if I want to talk to someone else? And I think it's so important for people to, if they need to, seek additional support, not just nurse/doctor information. And that's where groups like the ones Claire runs, which I'll ask her to tell us about, are invaluable, because cancer's scary. Then when it comes to cancer in an intimate area that we don't feel comfortable talking about because of society, it's not as easy to talk about as things like breast cancer, for example. So yeah, can you just tell us about the groups a little bit?
Yeah, well, after I was diagnosed, like I said, I hadn't heard of it, didn't know anything. I did find a couple of online support groups, but they were mostly Americans and other countries in the group, and they obviously don't have the NHS, they don't have the same treatment as us. So I started my own, which is the Vulva Cancer UK Awareness Support Group. It's only for those that have actually been diagnosed. If you haven't been, I do pass on the Macmillan Forum, yourselves and others, for help as well. Also, I help them all one-to-one. That one I set up 4 years ago. Again, like you said, it's not just to help those through it, it's after, because you get all these different pains and symptoms and electric shock symptoms, and you worry it's back. And when you speak to others and you realise they've all got it. And yes, the mental health side of it and life after, once your treatment ends, it all ends and you're just left. So that makes a big impact, having others to talk to. I also joined the the LS group as well, which is run by Emma Norman. So we met in her LS group, and after a little while we talked quite a bit off the group, and she decided she wanted to do a website. So I said, can I do it with you? So doing 2 separate ones. So we run the website together, which is lsvcukawareness.weebly.com. We're not a charity. We don't have any money. It's all done by ourselves. We just do it all by ourselves. So we have the LS support group. That is for anyone that thinks they have LS or do have LS. Any country is welcome in that one. We also run alongside an international LS group as well for those that aren't in the UK, just so they've got more people that they can speak to find out about their healthcare system. I also run a support group for VIN, those that are just diagnosed with VIN, which is the pre-cancer side, because I noticed in my support group I had mix of VIN and cancer patients, and a lot of the VIN members found it difficult to ask for help and just to have a little rant, because they felt almost like they were fought in a group of cancer sufferers and they felt awkward asking questions. So I decided to separate it. So I also run a UK VIN group as well. And then I set up a couple of years ago a separate group for gynecological or those that have been diagnosed with genital cancers that have now got lymphedema, because that's also hard as well. Because a lot of lymphedema groups are mainly primary and not secondary, or have it from breast cancer. It's in the arm. So I decided to set up one for that as well. So I run that, and which Emma also helped me with. We both do everything together, the awareness side and all the support groups as well, which we have separate accounts on Twitter and on Instagram, and then we do the awareness page on Facebook together.
Apart from that, you're not very busy, are you, Claire?
One job, yes.
Apart from that, that took up most of our time together, just listing the amazing things you do in your free time. Claire, we are. I'm in awe of how much effort you put into helping others, and it's really incredible. We will we're out of time on this episode, but we will kind of, when we promote the episode on our social media channels, we'll like tag the different support groups that Claire mentioned, so people can easily click through and find her and Emma and the people that they help easily, if it's something you need to look into, if you're affected by. Claire, thank you so much. We could have done 2 hours rather than 35 minutes, but thank you so much for telling us about vulval cancer, telling us about your experience of vulval cancer and how people can advocate for themselves and seek help. Thank you so much. I'll talk to you backstage in a sec, Claire.
Yeah, thank you.
Thank you. Oh, I think, wow, what a woman. I think it's really incredible that Claire spoke to us kind of with such, also just like really honest conversation as well. That's why we do Probably Nothing, that we want to have really frank conversations about the realities of what to look out for, to know what's normal for you. And please seek help if you think that something has changed, whether it's your vulva, your periods, any gynae cancer, potential symptom. Please do seek advice. Okay, so I've run out of time. Thank you so much to everybody that watched. We will upload this episode to our social media channels and YouTube channels, so if people can't join live, they can watch on catch up, and we will link to the support groups that Claire mentioned as well. And we will be back next week on the 12th, Tuesday the 12th of October, for episode 2. And also you can contact our Ask Eve service, nurse@eveappeal.org.uk, and if you need to talk to Tracy or myself, that's our information email address, and we're always there to answer any type of gynae health query. Thank you so much for watching. See you later.